Hello and welcome to the Daily Aus. I'm Zara.
I'm Sam.
Have you ever avoided a visit to the dentist because of how much it costs? Well, if you are sitting there nodding yes to that question, chances are you are not alone. According to a new report, 1 in 2 Aussies without private health insurance has avoided the dentist due to high costs. In today's deep dive, we're going to explore what we learned from the Australian Institute of Health and Welfare's new report and what it means for the average Aussie. Sam, it has been so long since we've done a podcast together.
I'm Sam, by the way. It's lovely to meet you.
Pleasure to meet you and run a business with you. But glad to be back on with you, especially to talk about something I'd say is probably your worst topic on earth to talk about. I only realised once we got into the room how much you hate going to the dentist.
I really hate to be fulfilling stereotypes of, dentist phobia. I don't mean to be critical of the dentistry profession. As we're going to talk about today, it's very important. Mm-hmm. It takes a solid 2-week anxious build-up to get me to the dentist. I had a lot of orthodontic work in my teen years, and I think there was just bad experiences there. Anyway, this is, probably the worst topic for me to come back to. Great to be here.
Welcome back.
Let's talk about how much this delightful experience costs.
Okay. So, nail on the head there. The reason we're talking about it today is because of the cost. That's because the Australian Institute of Health and Welfare recently released a new report. It was into the state of oral health and dental care here in Australia. And I think the big headline to come out was that it is just very expensive.
Are we spending a lot as a country on the dentist?
Yeah, we're spending around $11 billion as a country on dental services each year. But if you think about that, those are the people that are going to the dentist. And what I find interesting is the people who aren't going to the dentist and why they're not going to the dentist. So 1 in 2 Aussies aged 15 and over didn't visit the dentist in 2022 to 2023. And according to this report, around 1 in 6 people who needed to see a dentist either delayed or didn't go and see that dentist. And 1 in 6 said that was because of the cost associated with it.
Right. It is quite expensive to go to the dentist, especially if you do need something urgently done or there is a complexity to what you need.
Yeah, exactly. And as with, any kind of cost accessibility point, it does disproportionately impact some groups. So we know from this report that First Nations people were more likely to avoid the dentist due to cost than non-Indigenous Australians. So that number was about 49% compared to 39%. And women were also more likely to avoid the dentist due to expenses than men. That one was around 43% compared to 35%.
So there's this group of Australians that are avoiding the dentist because of how much it costs. Within that group, there's a group who really need the dentist that are avoiding it because of how much it costs. Let's talk about private health insurance. What do we know about the group of Australians who have private health insurance?
Yeah, so, as we, I guess, would expect here, Australians without private health insurance are twice as likely to avoid the dentist because of cost compared to those with insurance. And that can be for any number of reasons. If you are in a position to get private health insurance, you are likely to, have access to more money in the first place. So there's quite a bit that goes into that. But AIHW spokesperson Dr. Adrian Webster said that even after private health insurance payments, out-of-pocket dental expenses still varied pretty significantly. So, for example, the median out-of-pocket cost of a preventative service, so something like removing plaque or stains, for patients with private health insurance, that could still range from $0 to $82. So even with private health insurance, we're still getting a full kind of spectrum of cost here. And, that's still after paying for private health insurance, creating some cost barriers for people.
So even amongst different groups of Australians, those with or without private health insurance, it does sound like quite a common experience to grapple with cost at the dentist.
Yeah, it is. And it was something, we uploaded this story to our Instagram, our TDA Instagram, earlier this week, and I was blown away by the engagement it got. There were people flooding our comment section, flooding our DMs, telling us about their own experiences with this. It really seems to have hit a nerve.
I think we've gotten to the root of that one.
Anyway, sorry, that was such a dad joke. But no, it was really something that was mirrored by our audience. The things that we saw in that AIHW report seemed to be reflected among broader Australia and certainly among young Australia. We did a call out to our listeners to ask them about their own experiences when it comes to accessing dental care. Here is what we heard from Paige, a TDA listener.
I put off going to the dentist for 3 years because the last time I went to the dentist, they told me that I needed my wisdom teeth out, but they quoted me $3,000 for that. And every friend that I spoke to basically paid around the same or more for their wisdom teeth removals, which just scared me. So I didn't go back until the infections and the pain was getting so bad that I got really desperate and Googled like what's the most affordable way to do this, and found one dentist in Melbourne that basically they have cap pricing. So they will do wisdom teeth removal for a certain cap price under $1,000, which was incredible. I ended up going with that option, but it's just so out of reach most of the time. And I just know so many people that paid like $5,000 just for a simple thing like wisdom teeth removal. Like that should be covered on Medicare because a lot of adults need that to happen. And it's not like you can just leave your wisdom teeth in.
At the end there, you can hear Paige referring to Medicare.
Well, I was going to ask about Medicare because immediately you just think, well, Medicare must cover the procedures that we all need.
Yeah, and in that thinking, you would be wrong.
Well, that's interesting that it's not covered. Talk me through that.
So it's not everything, but the majority of dental services are not covered by Medicare. And just a quick reminder while we're talking about Medicare here, we're referring there to Australia's Universal Health Insurance Scheme. And that is what guarantees that all Australians can access a range of health and hospital services at low or no cost. That's when we talk about bulk billing and all of those things. But yeah, as I said, those services mostly don't include dental services. And I went into a bit of a deep dive as to why this is the case. And it turns out when Gough Whitlam, who was the Prime Minister who first began designing what we now know as Medicare, but at that point was Medibank, turns out he did want to include dental, but that due to a number of things like the cost of it and the fact that he was busy negotiating with doctors about including, their services, it just didn't get included at that point. And obviously that was decades and decades ago, but in the years since, nothing's really changed and it remains mostly excluded today from the Medicare system.
Has it come up in Australian politics in the health policy arena in recent years?
It has, and as recently as last month, we had Health Minister Mark Butler talking about it. He was actually ruling out expanding Medicare support to include dental care. So he was asked about this, but, he rejected any calls to expand it. Instead, he was pointing to a Medicare scheme that gives children in eligible families access to $1,100 of dental services every 2 years. And that's why I was saying that not everything is excluded because there are some kind of programs for children and for certain groups, but the majority are excluded. But he was saying about that program that only 40% of eligible kids are using that service. And he said that the government's focused on actually lifting that number, not widening the pool of people who can actually access it. So that's the government of the day who have obviously the power to change these things and whatever else. But then we've got the Greens, and I'd say they have been the loudest advocates in our political system for including dental in Medicare.
I remember it coming up a lot last election.
Yeah, this has been, it's nothing new for them. They've been talking about it for a while. At the last election, like you mentioned, they committed to investing $77 billion over the decade to provide free dental care. I presume that they'll probably take the same or a similar approach to the next election, given that nothing has really given in that time since, the last election. And then if we look outside of politics and look at, industry stakeholders, we can see that the Consumers Health Forum, which is an accessible healthcare advocacy body, they're actually also calling for the same thing. So after the AIH report was released, their CEO, Dr. Elizabeth Devaney, said that there needs to be a Medicare overhaul to improve the public dental system. And she said, and I'm quoting here, "We have adults in some parts of the country waiting 500 or 600 days to get in on the public dental system. This clearly isn't a universal system which provides for all." So there she's calling for changes to the system itself.
It's a really interesting discussion, this one, because of the universality of dental care in terms, or at least an aspiring universality of dental care. But based on Mark Butler's comments you just told us about, doesn't sound like things are going to move very quickly anytime soon.
No. And the accessibility of services, of health services, isn't unique to just dental. We've spoken on this pod so many times before about, GPs. And we know that Medicare covers visits to general practitioners, but that there still remain these big issues in being able to find GPs who will bulk bill and being able to actually get into them. The same, of course, with psychologists. It seems like the government's really focusing their energies there, but that doesn't mean that, dental and accessibility to dental is an issue that's going away. So definitely one to keep an eye on.
It's great to sink our teeth into that one, Zara. Great to be back on the podcast as well. And thank you for joining us on the Daily Aus this morning. If you're listening to this podcast and you like what we do, it really means a lot when you support us. You can hit follow or subscribe if you're on Spotify or Apple. And if you're on YouTube, we'd love you to subscribe to our channel as well. We'll be back again with another episode tomorrow. Until then, go see the dentist and have a good day.